Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So this is a nice lady in her mid-40s, 45. She comes to me from out of state. Like 2/3 of my patients come where she had a grade 4 capsular contracture on the right and also on the left. She had her first set of implants 2006, what is above the muscle, 2006 ceiling above the muscle, and then she had drippling, and in 2010 she ended up getting silicone, what is below the muscle. So this is a grade 4 contracture that she has, and as you can see, it's very like soft appearing, but at the same time the capsule is on the hard side, a grade 4 contracture, and this was sitting underneath the muscle. I removed some of the tissue, incorporated above the muscle, and along with some residual inflamed tissue what was above the muscle. So the implant was removed and block on the right side, and as you will see as I cut in, we will see if this is indeed ruptured or not. And as I go in, it indeed is ruptured, and all contained, none of this spilled into the chest. And this is a surprise for me if you ask me, but look at this, ruptured, and this is supposed to be the gummy bear, better, safer, nicer. It had just been out 3 years, and look at this, there's nothing gummy about this, and look at the way this shell is essentially there, but the implant has literally disintegrated. And these are, as you can see, all of this was contained, none of this spilled into the chest. You can see some calcifications that are starting to form, and the capsule is relatively thick, which certainly worked in my favor as I was dissecting, but you can see my blue glove. And again, this goes to show you, you never know what you're going to find. You have to always assume that they are ruptured till proven otherwise. And so I'm not able to see, I just want to show you. Look at this implant, what is supposed to be the gummy bear, and it literally is very, very non-cohesive, if you will, just like the implants before 1992, before the silicone implants were banned. Yes, when they do come out and you cut through it, it is overall gummy bear, but as you can see clearly, there's nothing gummy about it. What I'm going to do next is I'm going to go ahead and remove my outer glove. You can focus on this other side now. And as I go in, so as I was dissecting on the left side, I cut some of the excess skin out, and this is the scar tissue. As I was dissecting, so I got a new pair of gloves here. As I was dissecting, everything went great, beautiful, beautiful. But as you will see right here, you have where there is the rib, and in between the rib, this was super tightly adhered. So there was an inevitable break. And now as soon as that happened, I took this sponge and I basically covered it like this. And then I continued to dissect. And this is the hardest part of the case. I do it at the very, very end because that is the most challenging part. And so as you will see, as I covered this up, none of the silicone spilled into the chest, and you can see it forms like a seal. So even if I press over here, it doesn't leak out, and this kind of works as a plug, if you will. So as you can see clearly, this is ruptured. And again, grade 4 capsular contracture. And as you will see, no spillage of the silicone into the chest. All of it contained, done 100% total capsulectomy, and all inflamed tissue removed. So as I go, and this is, by the way, a piece of the cartilage right here off of that perichondrium of the rib, and this is another piece of that cartilage. So I'm going to go ahead and pick up, and as I go in, you will see what is clearly a ruptured implant. And again, this goes to show you, I did not know that she was going to be ruptured on the right or the left. And you can see, look how literally like honey it is pouring down, if you will. This capsular tissue is relatively thinner than the left, and you can see some patches of white. And overall, I'm very happy with how the whole dissection has gone. And if I may, you can see this has disintegrated. I'm trying to see if there's anything on the back. No. So Look at this. And then you have the inflamed tissue above that I'm going to send separately. So this goes to show you implants, they're not meant to be in the body forever. They are not lifetime devices, quote unquote. This is per manufacturer. Number two, per guidelines, you need surveillance to look for when is a rupture. She might have been ruptured for some time. These have been in just 14 years. And she had a grade 4 capsular contracture on the right and also on the left. So this is how I do it. I remove the entire implant, capsule, all inflamed tissue as one system, incorporating all inflamed tissue, leaving behind good, healthy, viable tissue because that's precious volume for the patient. No lift. Look at the inflammation that's present. No need for drains. Twilight sedation, deep sedation. Patient is very comfortable, very effective, practical anesthesia. Number 4, capsules are always sent to pathology. Rule out the PLLC, CD30 analysis, rule out lymphoma, rule out malignancy. The residual capsules, what is above the muscle from 2006 saline implant, will be sent separately. Cultures for aerobic, anaerobic, and fungal, number 5. Number 6, I take pictures, high definition, not only of what I'm doing here, but also most importantly of the chest, showing complete removal of the capsule off of the rib, off of the fascia of the intercostal muscle, fascia of the serratus anterior, fascia of the pectoralis minor, the fascia inferior below the pectoralis major, such that all of this tissue is removed along with the periosteum, perichondrium, such that there is no potential inflammation left behind, so the patient gets the best chance to bounce back. And then, this is the last but not least, all patients have consistently gotten the same surgery regardless. This is not the time to be doing aesthetic surgery because there's so much inflammation in and around the chest. So I'm overall very happy how the surgery has gone. I could not have been happier despite what is a cut in that capsule, which was unavoidable, and I was able to plug it very effectively like I have done many times. And the whole purpose here is leave no burden, no inflammation, no silicone, no inflamed tissue behind, such that the patient has the best chance to bounce back to a normal state of recovery minus the silicone toxicity. And then everything was tested so that there is no doubt, no surprises later on. Please share. This is Dr. Khan, Executive Plastic Surgery.